हेलो स्टूडेंट्स, आज हम ऑक्सीजनेशन का दूसरा वीडियो डिस्कस करेंगे। तो स्टार्ट करते हैं। क्वेश्चन नंबर 1, द नर्स इज सक्शनिंग ए पेशेंट विद ए tracheostomy ट्यूब। विच एक्शन विल द नर्स टेक? ए. Set suctioning regulator at 150 to 200 mmHg. B. Limit the length of suctioning to 10 seconds. C. Apply suctioning while gently rotating and inserting the catheter. D. Liberally lubricate the ends of the suction catheter with a water-soluble solution. तो इसका सही आंसर है limit the length of suctioning to 10 seconds. Question number 2. The nurse is caring for a patient with respiratory problem. Which assessment finding indicate a late sign of hypoxia? Number A. Elevate blood pressure. Number B. Increased pulse rate. Number C. Restlessness. Number D. Cyanosis. तो इसका सही आंसर है cyanosis. Question number 3. A nurse is caring for a patient with left-sided hemiparesis who has developed bronchitis and has a heart rate of 105 beat per minute, blood pressure of 156 by 90 mmHg, and respiration rate of 30 beats per minute. Which nursing diagnosis is priority? A. Risk for skin background. B. Impaired gas exchange. C. Activity intolerance. D. Risk for infection. तो इसका सही आंसर है impaired gas exchange. The nurse need to closely monitor the oxygen status of an older adult patient undergoing anesthesia because of which age-related change? Number A. Thinner heart valves cause lipid accumulation and fibrosis. B. Diminished respiratory muscle strength may cause poor chest expansion. C. Alternation in mental status prevent patient awareness for ineffective breathing. D. An increased number of pacemaker cells proper anesthesia induction more difficult. तो इसका सही आंसर है diminished respiratory muscle strength may cause poor chest expansion. Question number 5. A patient has inadequate stroke volume related to decreased preload. Which treatment does the nurse prepare to administer? A. Diuretics. B. Vasodilators. C. Chest physiotherapy. D. इंट्रावेनस IV फ्लूइड. तो इसका सही आंसर है डी, इंट्रावेनस IV फ्लूइड. A patient heart rate increase from 94 to 164 beat per minute. What will the nurse expect? A. Increase in diastolic filling time. B. Decrease in hemoglobin level. C. Decrease in cardiac output. D. Increase in stroke volume. तो इसका सही आंसर है decrease in cardiac output. Question number 7. The nurse is caring for a patient who need oxygen via nasal cannula. Which task can the nurse delegate to the nursing assistive personnel? A. Applying the nasal cannula. B. Adjust the oxygen flow. C. Assessing lung sound. D. Setting up the oxygen. तो इसका सही आंसर है applying the nasal cannula. Question number 8. Which nursing intervention is most effective in preventing hospital-acquired pneumonia in an older adult patient? A. Discontinue the humidification delivery device to keep excess fluid from the lungs. B. Monitor oxygen saturation and frequently auscultate lung bases. C. Assist the patient to cough, turn and deep breathe every 2 hours. डी डिक्रीज फ्लूइड इनटेक टू 300 ml ए शिफ्ट। तो इसका सही आंसर है सी assist the patient to cough, turn and the deep breathe every 2 hours. Question number 9. A nurse is caring for a patient with chronic obstructive pulmonary disease COPD who is receiving 2 liters per minute oxygen. Which oxygen delivery device is most appropriate for the nurse to administer the oxygen? Nasal cannula A, B. Simple face mask, C. Non-rebreather mask, D. Partial non-rebreather mask। तो इसका सही आंसर है ए नेज़ल कैनोला। Question number 10. A nurse is teaching a health class about the heart. Which information from the class member indicates teaching by the nurse is successful for the flow of blood through the heart starting in the right atrium? तो ए ऑप्शन है राइट वेंट्रिकल, लेफ्ट वेंट्रिकल, लेफ्ट आर्ट्रियम। बी लेफ्ट आर्ट्रियम, राइट वेंट्रिकल, लेफ्ट वेंट्रिकल। सी राइट वेंट्रिकल, लेफ्ट आर्ट्रियम, लेफ्ट वेंट्रिकल। और डी जो है लेफ्ट आर्ट्रियम, लेफ्ट वेंट्रिकल, राइट वेंट्रिकल। तो इसका सही आंसर है सी राइट वेंट्रिकल, लेफ्ट आर्ट्रियम, लेफ्ट वेंट्रिकल।